ChatGPT. How to reduce anxiety. How can I deal with anxiety? Dealing with anxiety can be challenging, but there are many effective strategies that can help. Here are some suggestions. 1. Practice relaxation techniques. This can include deep breathing exercises, progressive muscle relaxation, or meditation. 2. Exercise regularly. Exercise can help reduce anxiety and improve your overall mood. 3. Challenge anxious thoughts. Try to identify and challenge negative or irrational thoughts that are fueling your anxiety. 4. Connect with others. Spending time with friends and family, or participating in social activities, can help reduce stress and improve mood. 5. Get adequate sleep. Lack of sleep can exacerbate anxiety, so it's important to get enough rest. 6. Avoid caffeine, alcohol, and nicotine. These substances can increase anxiety levels. 7. Mindful activities. Engaging in activities that you find enjoyable, such as hobbies or creative pursuits, can help you relax and reduce anxiety. 8. Professional help. If your anxiety is severe or affecting your daily life, consider seeing a mental health professional for therapy or medication. Remember, everyone is different and what works for one person may not work for another. It's important to experiment with different strategies and find what works best for you. If I am currently feeling anxiety, either generalized or with reference to particular topics, can you walk me through how I would approach the topic of a relaxation technique? Certainly. Here is a simple deep breathing exercise that you can try if you're feeling anxious. 1. Find a quiet, comfortable place where you can sit or lie down and relax. 2. Close your eyes and focus on your breath. Take a deep breath in through your nose, filling your lungs completely. 3. Hold your breath for a moment, and then slowly exhale through your mouth. 4. Repeat the deep breathing process several times, focusing on the sensation of the breath moving in and out of your body. 5. As you breathe, try to clear your mind and focus only on your breath. If other thoughts come to mind, simply acknowledge them and return your focus to your breath. 6. Continue this deep breathing exercise for 5 to 10 minutes, or for as long as you need to feel relaxed. This is just one example of a relaxation technique that can help you manage anxiety. You can also try progressive muscle relaxation, guided imagery, or meditation. It's important to find what works best for you and to make relaxation a regular part of your routine. If I am feeling anxious, I might feel very hesitant to do a relaxation technique. Not only am I worried that the technique might not effectively deal with the perceived threat, it almost seems insulting when someone says, "Just relax." What might convince me to engage with such a relaxation practice if I feel anxious? I understand that when you're feeling anxious, it can be difficult to believe that relaxation techniques will be helpful. However, it's important to remember that anxiety is a normal and natural response to stress, and it's something that everyone experiences from time to time. Relaxation techniques have been shown to be effective in reducing anxiety and improving overall well-being. Here are a few reasons that might convince you to give them a try. 1. They have been scientifically proven to work. There have been numerous studies that demonstrate the effectiveness of relaxation techniques in reducing anxiety and stress. 2. They are easy to do. Relaxation techniques are usually simple to learn and can be done anywhere, at any time. 3. They are safe. Relaxation techniques are a safe and natural way to manage anxiety, with no negative side effects. 4. They can improve your overall mood. Relaxation techniques can help reduce stress and improve your overall mood, making you feel happier and more relaxed. 5. They are cost-effective. Relaxation techniques are a low-cost way to manage anxiety, without the need for expensive treatments or medications. It's important to remember that it may take some time to see the full benefits of relaxation techniques, and that everyone responds differently. But with patience and persistence, you may find that they are a helpful tool in managing your anxiety. Contextualizing anxiety as a response to stress helped me to trust that there is method to relaxation, but I am worried that if I lay down and breathe deeply, I will simply suffer through anxiety for 5 minutes. Can you provide me a few more practical steps during my deep breathing to direct my thoughts? Certainly. When you're feeling anxious, deep breathing can be a helpful tool to calm your mind and reduce your anxiety. Here are a few practical steps that you can use during deep breathing to help direct your thoughts. 1. Focus on your breath. As you breathe deeply, try to focus on the sensation of the breath moving in and out of your body. Pay attention to the feeling of the air as it enters and exits your lungs. 2. Visualize calmness. As you breathe, try to visualize a peaceful and calming image in your mind. This could be a beautiful landscape, a serene body of water, or anything else that brings you a sense of peace and calm. 3. Repeat positive affirmations. You can also try repeating positive affirmations to yourself as you breathe. For example, you might repeat phrases like "I am calm," "I am safe," or "I am in control." 4. Count your breaths. Another option is to count your breaths as you inhale and exhale. This can help you focus on the present moment and reduce distracting thoughts. 5. Practice gratitude. As you breathe deeply, try to think of things in your life that you are grateful for. Focusing on the positive aspects of your life can help shift your focus away from anxious thoughts. Remember, the goal of deep breathing is not to eliminate anxious thoughts completely, but to reduce their intensity and help you feel more calm and in control. With practice, deep breathing can become a powerful tool in managing your anxiety. If I would sit for 5 minutes a day and just think about the sensation of my breathing, what is likely to happen after a week and after a month? If you practice deep breathing for 5 minutes a day, you are likely to see a number of positive changes over the course of a week and a month. Here are some of the benefits you might experience. After a week. 1. Improved relaxation. You should start to feel more relaxed and calm after just a few days of deep breathing. 2. Reduced anxiety. Regular deep breathing can help reduce feelings of anxiety and stress. 3. Better sleep. Deep breathing can help you fall asleep faster and improve the quality of your sleep. 4. Increased focus. Regular deep breathing can help improve focus and concentration, making it easier to stay on task. After a month. 1. Increased resilience to stress. With continued practice, deep breathing can help you become more resilient to stress and better able to manage difficult situations. 2. Improved mood. Regular deep breathing can help improve your overall mood, making you feel happier and more positive. 3. Lower blood pressure. Deep breathing has been shown to lower blood pressure, reducing the risk of heart disease and stroke. 4. Better physical and mental well-being. Regular deep breathing can improve both physical and mental well-being, helping you feel more energetic and focused. It's important to keep in mind that everyone's experience with deep breathing will be unique, and that some people may see greater benefits than others. However, by making deep breathing a daily habit, you are likely to see significant improvements in your overall well-being over time. How important is setting a timer for this kind of exercise? Setting a timer for deep breathing exercises can be helpful in a few ways. 1. Establishing a routine. By setting a timer, you can make deep breathing a regular part of your daily routine. This can help ensure that you are practicing regularly and reaping the benefits of deep breathing over time. 2. Limiting distractions. When you set a timer, you can minimize distractions and focus solely on your breathing. This can help you get the most out of your deep breathing exercises. 3. Ensuring enough time. Setting a timer can help ensure that you are taking enough time for deep breathing. A 5-minute deep breathing exercise can be beneficial, but if you find that you need more time, you can adjust the timer accordingly. 4. Preventing overdoing it. It's also important to note that it's possible to overdo deep breathing exercises, so setting a timer can help prevent you from doing too much too soon. Overall, setting a timer can be a helpful tool in establishing a regular routine and ensuring that you are taking enough time for deep breathing exercises. However, it's not strictly necessary, and some people may prefer to practice deep breathing without a timer. Ultimately, the most important thing is that you are engaging in deep breathing regularly and making it a part of your daily routine. Exercise can be hard to get to at the best of times, but I can imagine it could be particularly unappealing for a person suffering from anxiety. What might increase the motivation of a person suffering from acute anxiety, maybe even a taxed adrenaline system, to go out and exercise? Here are some tips that may help increase motivation for exercise for someone suffering from anxiety. 1. Start small. If exercise feels overwhelming, start with just a few minutes a day and gradually increase the duration and intensity as you feel more comfortable. 2. Focus on the benefits. Regular exercise can help reduce anxiety, improve mood, and boost self-esteem. Focusing on these benefits can help increase motivation to exercise. 3. Choose an activity you enjoy. Doing an exercise that you enjoy, such as hiking, dancing, or swimming, can make it feel less like a chore and increase motivation. 4. Find a support system. Joining a group fitness class, working out with a friend, or hiring a personal trainer can provide accountability and a supportive environment, making it easier to stick to an exercise routine. 5. Incorporate mindfulness. Incorporating mindfulness into your exercise routine, such as focusing on your breathing and body sensations, can help reduce anxiety and increase motivation. 6. Reward yourself. Create a system of rewards for reaching exercise goals, such as a relaxing massage, a special treat, or a new outfit. This can provide a sense of accomplishment and increase motivation. 7. Seek professional help. If anxiety is affecting your ability to exercise, consider speaking to a mental health professional who can provide tailored advice and support. Remember, it's okay to take things slow and be gentle with yourself. The important thing is to start small and build gradually, focusing on making exercise a regular part of your routine. Over time, as the benefits become more apparent, your motivation to exercise is likely to increase. Can you give me a ballpark on anxiety levels and school performance and work performance between a person who exercises and a person who does not exercise, all things being equal? Research has shown that exercise can have a positive impact on anxiety levels and can improve school and work performance. In terms of anxiety levels, regular exercise has been shown to be an effective way to reduce symptoms of anxiety and improve overall mental health. Exercise can release endorphins, which are natural chemicals in the brain that promote feelings of well-being, and can also help reduce the physical symptoms of anxiety, such as rapid heartbeat and sweating. In terms of school performance, research has found that exercise can improve cognitive function, including memory, attention, and concentration. This can translate into improved school performance, particularly in areas such as test taking and academic achievement. In terms of work performance, regular exercise has been shown to improve energy levels, reduce stress, and increase focus and productivity. Exercise can also help improve sleep, which is essential for optimal work performance. It's important to note that while exercise can have a positive impact on anxiety levels and performance, it is not a guarantee and individual results may vary. Additionally, there may be other factors that can impact performance, such as sleep, diet, and stress levels. Overall, incorporating regular exercise into your routine can help improve anxiety levels and overall performance in school and work. But it's important to work with a healthcare professional to determine the best course of action for your individual needs. In a state of anxiety, negative, irrational, and limiting thoughts can seem particularly salient. When such a negative thought or feeling seems so real, how can I recognize that it is just a thought or feeling, much less challenge its validity? Recognizing that negative thoughts and feelings are just that, thoughts and feelings, and not necessarily a reflection of reality, is an important step in managing anxiety. Here are some tips that can help. 1. Practice mindfulness. Mindfulness involves paying attention to your thoughts and feelings in a non-judgmental way, and recognizing them as separate from your true self. By practicing mindfulness, you can develop a greater awareness of your thoughts and feelings and learn to step back from them, rather than getting caught up in them. 2. Challenge the thoughts. When you find yourself having a negative thought, try to challenge its validity. Ask yourself questions like, is this thought really true? Or what evidence do I have to support this thought? By questioning the validity of your thoughts, you can gain a more balanced perspective and reduce the power that negative thoughts have over you. 3. Practice cognitive restructuring. This involves changing the way you think about a situation. For example, if you have a negative thought about a situation, try to reframe it in a more positive or neutral way. Instead of thinking I'm going to fail this test, try thinking I've prepared as best I can and I'll do my best. 4. Focus on the present moment. When you're feeling anxious, it's easy to get caught up in thoughts about the past or worries about the future. Focusing on the present moment can help reduce anxiety by bringing your attention back to what's happening right now, rather than getting lost in negative thoughts and feelings. 5. Use positive self-talk. Practice talking to yourself in a kind and supportive way. Instead of criticizing yourself, try to focus on your strengths and abilities. Remember, it takes time and practice to develop the skills necessary to recognize and challenge negative thoughts and feelings, but with patience and persistence, you can learn to reduce their impact on your life. It's also important to speak to a mental health professional if you need additional support. How does connecting with others decrease anxiety? Connecting with others can have a powerful impact on reducing anxiety for several reasons. 1. Social support. When you connect with others, you can receive emotional support and encouragement that can help you feel less alone in your struggles with anxiety. Having people to talk to and confide in can make a big difference in reducing anxiety symptoms. 2. Distraction. Spending time with others can help distract you from anxious thoughts and feelings and provide a temporary break from your worries. 3. Increased sense of belonging. When you connect with others, you can feel a sense of belonging and connectedness. This can increase your sense of security and reduce feelings of isolation and loneliness, which are often associated with anxiety. 4. Improved self-esteem. Connecting with others can also help boost self-esteem. When you have positive social connections, you may feel valued and appreciated, which can help counteract negative self-talk and beliefs that often accompany anxiety. 5. Increased positive emotions. Spending time with others can also increase positive emotions, such as happiness and joy, which can help reduce anxiety levels. It's important to note that connecting with others can look different for everyone and can take many forms, such as spending time with friends and family, joining a support group, volunteering, or participating in social activities. The key is to find what works best for you and to make social connections a regular part of your routine. What if I don't want to disclose to people that I am feeling anxious? If you're not comfortable disclosing your anxiety to others, that's okay. There are still ways to connect with others and receive support without disclosing the specifics of your situation. Here are a few ideas. 1. Participate in group activities. Join a club, group, or organization that aligns with your interests. Engaging in group activities can provide a sense of belonging and connection without the need for deep personal conversations. 2. Volunteer. Volunteering can be a great way to connect with others and give back to your community. It can also help improve self-esteem and provide a sense of purpose. 3. Online communities. There are many online communities and forums dedicated to various topics and interests. Joining one of these communities can provide a sense of connection and support without the need for face-to-face interactions. 4. Practice self-care. Taking care of yourself is an important way to reduce anxiety and improve overall well-being. Practicing self-care, such as exercise, meditation, or hobbies, can help reduce stress and provide a sense of connection with yourself. Remember, it's okay to take things at your own pace and do what feels comfortable and safe for you. Seeking professional help from a mental health professional is also a valuable option if you're struggling with anxiety and don't feel comfortable connecting with others. Do people think it is strange if you reach out to them if you have not talked to them in a long time? If I just want someone to talk to? It's normal to feel nervous about reaching out to someone you haven't talked to in a while, especially if you're doing so for support. However, in most cases, people are usually happy to hear from friends or acquaintances, even if it's been a long time since you last spoke. If you're feeling anxious and need someone to talk to, it's okay to reach out to someone you trust, even if it's been a while. You can simply send a message saying something like, "Hey, it's been a while since we've talked. I've been feeling a bit anxious lately and could really use someone to talk to. Are you free to chat?" This gives the person a clear idea of what you're reaching out for and allows them to respond in a way that feels comfortable for them. In most cases, people are usually happy to help and provide support to friends and acquaintances in need. However, if you're worried about being rejected or coming across as strange, it may help to talk to someone you know well or have a close relationship with. Remember, it's important to prioritize your own well-being and to reach out for help when you need it, regardless of whether you think it may be perceived as strange by others. "I cannot sleep because of my anxiety. I'm too afraid to fall or stay asleep." Difficulty sleeping due to anxiety is a common experience. Here are some steps you can try to help you sleep. 1. Practice relaxation techniques. Before bed, try practicing deep breathing, meditation, or progressive muscle relaxation to calm your mind and body. 2. Create a bedtime routine. Establishing a relaxing bedtime routine can signal to your body that it's time to sleep. Try reading a book, taking a warm bath, or listening to soothing music before bed. 3. Limit screen time. The blue light emitted by electronic devices can interfere with sleep. Try to limit your screen time for at least an hour before bed. 4. Keep a regular sleep schedule. Going to bed and waking up at the same time every day can help regulate your sleep-wake cycle and make it easier to fall asleep at night. 5. Limit caffeine and alcohol. Caffeine and alcohol can interfere with sleep. Try to avoid consuming them, especially in the hours before bed. 6. Use the bed only for sleep and sex. Avoid using your bed for activities such as work, eating, or watching TV. This will help to establish a strong association between your bed and sleep. 7. Address your thoughts. If your anxiety is preventing you from sleeping, try to identify the specific thoughts or worries that are keeping you up. Write them down and challenge them with rational, evidence-based responses. 8. Seek professional help. If you continue to have difficulty sleeping, consider talking to a mental health professional. They can help you identify the underlying causes of your anxiety and develop a personalized treatment plan. Remember, good sleep hygiene is essential for overall health and well-being. If you're having persistent trouble sleeping, seek professional help to ensure that you receive the support and care you need. Can hormone therapy alleviate anxiety and reduce difficulties sleeping for some people? Hormone therapy can sometimes help alleviate anxiety and improve sleep in some people, especially those with hormonal imbalances. However, it's important to note that hormone therapy should only be considered as a treatment option after a thorough evaluation by a healthcare professional. For example, low levels of the hormone estrogen have been linked to increased anxiety and sleep difficulties in some women, particularly during menopause. Hormone replacement therapy, HRT, can help alleviate these symptoms by replenishing estrogen levels. In addition, imbalances in other hormones, such as cortisol, can also contribute to anxiety and sleep problems. Cortisol is a stress hormone that regulates the body's fight or flight response. If cortisol levels are consistently high, it can lead to feelings of anxiety and difficulty sleeping. It's important to work with a healthcare professional to determine the best treatment options for your specific symptoms and health needs. Hormone therapy may not be appropriate or effective for everyone, and there may be other treatments that are better suited to your needs. I have used caffeine for many years. Could a cup in the middle of the day really impact my sleep? Yes, drinking caffeine in the middle of the day can impact your sleep. Caffeine is a stimulant that increases alertness and energy levels. It works by blocking the action of a neurotransmitter called adenosine, which builds up in the brain over the course of the day and makes you feel tired. When you consume caffeine, it prevents adenosine from having its sedative effect, which can make it more difficult to fall asleep and stay asleep. The effects of caffeine can last for several hours, depending on factors such as the amount consumed, your tolerance, and your individual metabolism. For most people, the effects of caffeine peak about 30 to 60 minutes after consumption and can last for 4 to 6 hours. Drinking caffeine later in the day, especially within 4 to 6 hours of bedtime, can make it more difficult to fall asleep and may lead to a restless, disrupted sleep. If you have trouble sleeping and think that caffeine might be a factor, it's a good idea to keep track of when you consume caffeine and monitor any changes in your sleep patterns. You may also consider reducing or eliminating your caffeine intake to see if it makes a difference in your sleep quality. And a cup or two in the morning, followed by one at noon, could leave large amounts of caffeine in the system by midnight due to its half-life? Yes, drinking a cup or two of coffee in the morning, followed by one at noon, could result in large amounts of caffeine in your system by midnight. Caffeine has a half-life of about 4 to 6 hours, which means that it takes 4 to 6 hours for the amount of caffeine in your body to decrease by half. So, if you consume a cup of coffee in the morning and another at noon, you could still have a significant amount of caffeine in your system by bedtime. The effects of caffeine can vary depending on factors such as your tolerance, metabolism, and overall health. Some people may be more sensitive to the effects of caffeine and may experience more significant disruptions to their sleep patterns. while others may be less sensitive and may not experience any noticeable effects. If you have trouble sleeping and are concerned about the effects of caffeine, it's a good idea to monitor your caffeine intake and pay attention to any changes in your sleep patterns. You may also consider reducing or eliminating your caffeine intake, especially later in the day, to see if it makes a difference in your sleep quality. How do hobbies reduce anxiety? Hobbies can reduce anxiety by providing a sense of purpose and distraction from worries. Engaging in a hobby can give you a sense of accomplishment and satisfaction, which can help to boost your self-esteem and confidence. When you're focused on a hobby, you're less likely to dwell on anxious thoughts and feelings, which can help to reduce your overall anxiety levels. In addition, hobbies can provide a sense of structure and routine, which can be particularly helpful for people with anxiety. By having a set time and place to engage in a hobby, you can create a sense of stability and predictability, which can help to alleviate feelings of uncertainty and insecurity. Hobbies can also provide a way to connect with others who share similar interests. This can help to build relationships, reduce feelings of isolation, and increase social support, which can all contribute to lower levels of anxiety. It's important to find a hobby that you enjoy and that you can realistically fit into your schedule. Some popular hobbies that can help reduce anxiety include gardening, reading, painting or drawing, knitting or crocheting, playing a musical instrument, cooking or baking, photography, hiking or outdoor activities. Try different hobbies until you find one that you enjoy and that provides a sense of relaxation and distraction from anxious thoughts and feelings. Can you please identify 4 critical assumptions in your last answer, then explain the assumptions underlying these assumptions? I apologize, but as an AI language model, I do not hold assumptions or beliefs in the traditional sense. I provide information based on the data I was trained on and the current context of the question being asked. Here are the 4 critical assumptions in my last answer, and the assumptions underlying these assumptions. 1. Hobbies can help reduce anxiety. This assumption is based on the idea that engaging in enjoyable activities can provide a sense of purpose, accomplishment, and distraction from worries, leading to reduced anxiety levels. This is a commonly held belief in the field of mental health and is supported by some research studies. 2. People need to find a hobby they enjoy. This assumption is based on the idea that people are more likely to stick with a hobby if they find it enjoyable, and that engaging in enjoyable activities can provide a sense of relaxation and distraction from anxious thoughts and feelings. 3. Hobbies can provide a sense of structure and routine. This assumption is based on the idea that having a set time and place to engage in a hobby can create a sense of stability and predictability, which can help to alleviate feelings of uncertainty and insecurity. 4. Hobbies can provide social support. This assumption is based on the idea that hobbies can provide an opportunity to connect with others who share similar interests, which can help to build relationships, reduce feelings of isolation, and increase social support, leading to lower levels of anxiety. All of these assumptions are based on the idea that engaging in enjoyable activities can have a positive impact on mental health, and that activities that provide a sense of accomplishment, structure, and social support can be particularly helpful for reducing anxiety. However, it's important to keep in mind that not all hobbies will work for everyone, and that what works for one person may not work for another. Why do you call hobbies or creative pursuits that I find enjoyable mindful activities? I apologize for any confusion. Mindful activities refers to activities that involve being fully present in the moment and paying attention to one's thoughts, feelings, and sensations without judgment. Engaging in hobbies or creative pursuits that one finds enjoyable can be considered a form of mindfulness practice, as it allows a person to focus their attention on the present moment and shift away from worry and anxiety-provoking thoughts. This shift in focus and attention can help to reduce stress and anxiety, promote relaxation, and improve overall well-being. It is common to refer to such activities as mindful activities, as they can provide an opportunity for mindfulness practice, even if the person is not specifically attempting to engage in mindfulness. No need to apologize, those are great answers. Finally, although it is important to consult with a physician or psychologist regarding their respective fields, can you outline some of the benefits that therapy or medication can provide, that a person might not receive through self-help alone? Sure. There are a number of benefits to seeking therapy or medication for anxiety that a person may not receive through self-help alone. Some of these benefits include: 1. Expert guidance. A therapist or mental health professional can provide expert guidance and support in managing anxiety. They can offer personalized recommendations and strategies to help you deal with your symptoms, and provide guidance and support as you work through the challenges you face. 2. A safe space. Therapy provides a safe and confidential environment where you can discuss your feelings and thoughts without judgment. This can help you feel more comfortable and confident in sharing your experiences, and can also lead to a greater sense of understanding and validation. 3. Structured treatment plan. A mental health professional can work with you to create a structured treatment plan that addresses your specific needs and goals. This plan can help to keep you on track and provide a sense of direction as you work towards recovery. 4. Medication. Medications such as anti-anxiety drugs or antidepressants can help to alleviate symptoms of anxiety and improve overall well-being. A doctor or psychiatrist can help determine if medication is a suitable option for you, and they can monitor the effects of the medication to ensure that it is safe and effective. 5. Dealing with underlying issues. Therapy can help you identify and address underlying issues that may be contributing to your anxiety. This can include past traumas, negative thought patterns, and relationship issues. By addressing these underlying issues, therapy can help to prevent future episodes of anxiety. In summary, therapy or medication can provide additional support and guidance for managing anxiety that may not be available through self-help alone. A combination of self-help strategies and professional treatment can be highly effective in reducing symptoms of anxiety and improving overall well-being.